So welcome everyone to our virtual family council meeting. My name is Jamie Rose. I'm the virtual family council coordinator. We're going to review our confidentiality statement at this time. Please refrain from using the name of your loved one. Do not name specific facilities. Please use a nursing home or the personal care home to present to the group. If you need specific assistance, please use the chat feature to state which county you are in, and we will get you connected to your assigned ombudsman. And a reminder, these calls have public access and are designed for family members and friends of residents in long-term care facilities. So we'll just review our meeting agenda. We're going to get our virtual meeting tips from Jay, and then we're going to hear from Eric Goldwein. He's going to talk to us about the latest nursing home reports and Long-Term Care Community Coalition's NursingHome411 data center. And then we're going to wrap up this evening with our upcoming meeting topics. So without further ado, I'll turn it over to Mr. Rotz and he'll give us our virtual meeting tips.
Thank you, Ms. Rose. First of all, everyone, you've been placed on mute upon entry. We'll open the lines in a bit so that you're able to share. If you would like to speak or have a question, please use the raise hand feature. Once you raise your hand, we will know to acknowledge you and unmute your line. If you hover your mouse near the bottom of the screen, you should see the Participants tab. That can be expanded if you'd like to see that. The chat feature is at the bottom of your screen too. If you have the question for the presenter, please message the chat moderator and they'll ensure that your question is asked. Closed captioning is available during these calls. Please find Enable Closed Captioning at the bottom of your screen if you would like to view captioning live. If you need to step away, you can stop sharing your camera by clicking on the camera icon at the bottom of the screen. You can click on it again to start sharing your camera again. And finally, concerns or complaints can be directed to me at the State Ombudsman Office at 717-783-8975 or by email at capital LTC-ombudsman@pa.gov. I put that in the chat in case you want to copy the number or email address. And to present tonight's featured speaker is the pride of Clearfield County, Jeannie Urban.
Hi there, group. Eric, thank you for being with us tonight and agreeing to speak to our group. Eric is the Director of Policy and Communications for the Long-Term Care Community Coalition. That's LTC, Long-Term Care, CC. As a member of the CCAAA, I'm really fond of your initials, Eric. Thank you for agreeing to provide the council with information on the most recent nursing home data center information known as NursingHome411. Eric is a public health professional with expertise in aging, athletics, and communications. He has a master's of public health degree at Columbia University, and he has published in the Washington Post, Slate, ESPN, and I would assume that has to do with his athletic prowess, and elsewhere. His duties as Director of Policy and Communications with the LTCCC include coordinating policy and communication strategy, advocating for nursing home residents, managing NursingHome411 data center, which features information on staffing, star ratings, and other U.S. nursing home information. This included redesigning the website, the nursingHome411.org, and launching COVID-19 Resource Center, which resulted in a 200% increase in web traffic and increased visibility in local and national media. He also is responsible for hosting and producing Nursing Home 411 podcast featuring interviews with experts in long-term care, coordinating and hosting virtual programs, including webinars and events, and leading tutorials on digital resources, including Zoom, Tableau, and Care Compare. We welcome you tonight, Eric. Thank you.
Thanks so much. And I feel a little left out not having a J first name after that introduction with you, with Jay and Jamie and Jean. But thanks for welcoming me here. I think we're working off a PowerPoint. Jamie, do you want me to share it or should I?
Sure, you're able to now.
Okay, great. I'm going to do that and hang tight. Okay, so hopefully we should be seeing a PowerPoint screen, correct?
Yep, there you are.
Are you seeing one with the full screen or with
Yep, full screen.
Okay, it's the full screen. Great. So thanks for welcoming me here. I'm going to be talking about using Nursing Home 411 data to support your advocacy. And it's important. I'm going to have a few data points that I'll throw at you, but this is more going to be about how to use the data and how to find it yourself, and to use these data points to find out what's going on at your nursing homes of interest. About me, that was a really wonderful introduction. I live in New York, but I'm from Lower Merion outside of Philadelphia. I'm a big basketball fan. I host the podcast for LTCCC. I manage our Nursing Home 411 data center. And just a few of my favorite things. That's my grandmother, my bubby's matzo ball soup. That's Lucy. That's my parents' dog. She lives in Philadelphia. She was not happy with the news that day, so she decided to eat the newspaper. And that's a basketball. I love basketball. And today I'm going to talk about data in nursing homes and long-term care as a representative of LTCCC. That's 3 C's. We are a nonprofit, nonpartisan organization dedicated to improving care and quality of life for elderly and adult disabled in long-term care. And we also house 2 LTC ombudsman programs. Our focus is on people who live in nursing homes and assisted living, and we do policy analysis, system advocacy, and then education of consumers, families, ombudsmen, and other stakeholders. And our website is nursingHome411.org. So we're going to learn how to find and interpret nursing homes data, nursing home staffing data, how to find information such as star ratings or ownership type, and how to find oversight and enforcement data that's based on our last report. And the reason this is important and the reason this can help you is that data is knowledge is power. If you are communicating with an administrator or you are communicating with a nurse, if you have numbers, if you have information, objective information to back up what you're saying, it gives you a much better chance of getting attention, and it helps inform your own advocacy, and it adds context to anecdotes. So say you are seeing a trend of understaffing. You want to be able to look at the nursing homes staffing data and actually see what are the specific numbers of RNs or CNAs at an average day. And these data, they don't lie. They can mislead and they need to be used in the right context, but the numbers themselves are objective. We got a busy agenda, so I'm going to do my best to go through it efficiently. First, I'm going to give a little data 101. Then I'm going to give you a tour of NursingHome411.org, and this will teach you how to show you how to find our different data resources. There's so much in there, so I don't really anticipate anyone's going to remember every detail, but I'll have links in there that should help you get to where you want to go. Then we're going to talk about staffing and how to use our staffing data and how to look at different at nursing homes in different cities, how to look at nursing homes in an entire county or city if you're, say, an ombudsman who covers a certain area. And we're going to do the same thing with our provider information data. And these data include star ratings, they include ownership type, they also include information such as, does a nursing home have a family council? Does a nursing home have a resident council? It has just loads of information. And then the last main thing I'll be discussing is we published a report a few weeks ago about nursing home enforcement and oversight. And this was an assessment of surveys of nursing homes, and I'll explain in more detail later, but this is surveyors go into nursing homes and they search for deficiencies, and our report covers what happens and what surveyors are finding and what they aren't finding. So just some data 101, or I should call these just data limitations. Data are pieces of the puzzle, and it's important to know that numbers won't ever tell the whole story. What you're seeing, a story you're hearing, if there's a number that doesn't necessarily align with what you're hearing, that doesn't necessarily mean that what you're hearing is wrong. It just means that this is the number, that's what the number says, and this is what happened. So data are one piece of a very complex puzzle. Causation, just a causation correlation warning. Causation does not mean correlation. If you happen to eat ice cream and then get sunburnt, it's not the ice cream that is burning your skin. It's likely because you are eating ice cream on very hot days. So just keep that in mind when you're looking at data. And lastly, if a data source is not accurate, or if there's something fishy going on, there are human beings involved in putting together these data. There's sometimes data entry errors. I remember when we were first looking at COVID data, there was one facility that reported 1,200 COVID cases, and it was a 120 bed facility. And what I imagine happened was that somebody just typed the wrong number or forgot to move a decimal place, and it was just errors happen. And just keep in mind that these data sets aren't perfect. Some are more accurate than others, some have more issues than others, but just keep in mind that they're not without flaws. So let's start with our website. It's NursingHome411.org. If you're to go to our homepage, this is what it will look like. And the way to get to our data center is on the top of the page, there is a menu item that says Data Center. So that's one way to get there. You can also go to NursingHome411.org/data. When you get to this data page, you'll see a number of categories. What we're going to go over today is staffing, then ratings and information. But you can also look at problem facilities, and this is a data set that only includes nursing homes that are 1-star or are special focus facilities or special focus facility candidates. These are, we call them problem facilities because these are facilities that are nursing homes that have a history of problems. When I say 1-star rating, each nursing home is assigned an overall rating of 1 to 5 stars, and 1 is the lowest. But again, what we're going to focus on today is the staffing and then the ratings and information. We also have state pages, and we're really building these up, and there's a lot of state-specific information. Sometimes what happens in New York is not of relevance to Pennsylvania. Something what happens in Michigan might not be of relevance to someone in California. So what we're doing is we're separating some of our articles and our data into individual state pages. So if you look at this page here, NursingHome411.org/PA, you'll see Pennsylvania staffing data. You'll see a link to nursing home ratings in Pennsylvania. You'll see a link to the long-term care ombudsman website. And we also, there's an organization, CARI, which we find has helpful resources that are PA focused. So again, we have this for every state, but the way to get to Pennsylvania's is to go to nursingHome411.org/PA or to the state page, so nursingHome411.org/states. And from there, you'll see a map that you'll be able to click Pennsylvania and get to this page. Staffing data. So before we get into the numbers, staffing is really where it all starts. Facilities, nursing homes that are well-staffed tend to perform better, tend to have fewer problems. They're better equipped to manage care and to provide activities for residents. They're better prepared in the event of a once-in-a-century pandemic. As we've learned, nursing homes with higher staffing levels have had lower COVID rates, have had lower rates of COVID deaths, and they have generally performed better. And there's all sorts of research supporting the benefits of higher staffing levels and of better staffed facilities. So as a general rule, more staff is associated with better care for residents. Of course, that's not always 100% true. There could be a nursing home with high staff levels that doesn't perform well, but as a general rule, you want higher staffing. So what we do is every quarter we take federal data from CMS, the Center for Medicare and Medicaid Services. This is payroll-based journal data for every US nursing home, and we find the average staffing levels for the quarter. So this data is broken down by position. You can see the average level of RNs, average CNAs, average LPNs, and we also include non-nurse positions, including physical therapists, social workers, medical directors. So you can really dive in and you can look at the whole number or you can look at individual positions. And this is our second quarter staffing report, which I'll go over the findings, but I think more important than going over the findings is knowing how to navigate the report itself. So you'll see those purple buttons include links to the nursing home staff data. That's again, the RNs, the LPNs, the CNAs, the non-nursing staff. So that's the physical therapists, social workers, and then contract staff. And that is how heavily a nursing home is using contract workers. Now, if you only want to access Pennsylvania's, this on the bottom of the screen, it lists all the states and their total nurse staffing ratios. And you can click Pennsylvania on the screen. You can only see it down to DC. But if you scroll down and click Pennsylvania, you'll open a spreadsheet that provides information on all, I believe it's 600 something Pennsylvania nursing homes. Some takeaways of the statewide findings. There's 60,000 residents in Pennsylvania, almost 700 nursing homes. As a state, the total nurse staff, HPRD, that's a four-letter, a calculation you'll hear a lot. This is hours per resident day, and it's calculated by dividing a nursing home's daily staff hours by its census. So a nursing home with 300 total nurse staff hours and 100 residents would have a staff ratio of 3.0 total nurse staff HPRD. Now, the number you want to get to as a rule of thumb is 4.1. That's based on a 2001 federal study. We suspect you should probably have significantly more than 4.1, but 4.1 is the number that is used. And Pennsylvania statewide averaged 3.64. And this is middle, lower of the pack compared to other states. I think it was ranked 40th overall. Now, not all staffing positions carry equal importance. I'd say it's not the good news, but it's better news that the total RN staff in Pennsylvania ranks 23rd. RNs are a very important position. So they're middle of the pack in RNs, but closer to bottom of the pack in overall. And interestingly, it seems that Pennsylvania relies more on contract staff workers than other states. It accounted for nearly 1 in 10 nurse staff hours in the past quarter, whereas in the US, contract workers accounted for roughly 6%. And what might concern you as a family member or as an ombudsman or as an advocate is, how can I find these numbers? How can I look up a particular specific facility, or how can I see what's going on in a certain city or region? So I mentioned on the previous page, if you scroll down and clicked Pennsylvania, you'd be brought to an Excel file, which contains a lot of important data that's easy to get lost in. And I'm going to try to help you navigate these files. And I'll actually do a screen share with the Excel file in a little bit. But this is what the file will look like. And you can do different things such as sort it by county with this is called a slicer. You can sort it by city. You can look up a specific facility by clicking this little triangle. So say that you wanted to look up Abington Manor, which actually happens to be right there, but you could click the triangle and you'd be brought to a search function and you would type in Abington. Or say you wanted to look up only nursing homes in Montgomery County, that's where I'm from, you could click the little triangle next to county and look up what's going on. So I'm actually going to exit out of this and quickly get right back to an Excel spreadsheet. Let's see, here's all windows. PA staff. So this is the Pennsylvania staffing spreadsheet. And it's really intimidating to look at. There's a lot of numbers, a lot of columns, and I just lost it on my own screen. That's how intimidating it is. But what you can do here is you can filter by county. So say I wanted to look up Montgomery County, click this, and now it's only Montgomery County facilities. Now say I wanted to look up facilities in Philadelphia. You click this little triangle next to city and you type in Philadelphia. And now these are what we're saying are only Philadelphia facilities. This total nurse staff HPRD is one of the important numbers to assess when you are looking at nursing home staffing data. You can see there's a range of values from Bala Nursing and Retirement Center is 3.54. Some are closer to 5, 6, but you can look at the total nurse staff. You can look at individual positions and such as total RN staff. And if you really want to dig in, you click this little box and I move this out of the way. You can look at specific positions and how facilities fare. Now, it's important to look at some of these columns have HPRD, and when it says HPRD, that is a ratio. So that is hours per resident per day. When it does not have an HPRD next to it, that's just the total hours. So as an example, Bala Nursing Home has 466 total nurse staff hours, and its total nurse staff ratio is 3.54, and that is because it has 132 residents. So you can really dig in, and this is the nurse staff. We also have contract, or I'll go to non-nurse staff, and this again shows you individual positions such as dietitian, pharmacist, medical director hours, and just some more information about the numbers. This means that on a given day, this nursing home averaged 1.31 hours of dietitian staffing, which is different from HPRD. HPRD is, again, a ratio of total hours to residents, whereas if it does not say HPRD, it is just the total hours. So you can really dig in, say you wanted to find out what's going on at, who we're going to pick on, at Avalon Place. You could learn the exact number of hours of total social work or occupational therapy, HPRD, or feeding assistance hours. And some of these have 0, some of these have higher numbers. So you can really dig in. And again, some of these numbers have more meaning and value than others, and they need to be viewed in context of some of the other information that you have. I'm going to go back to the PowerPoint. Okay. So that was staffing. Now we're going to talk about provider information and ratings. I think this is in some ways even more important than the staffing data because it provides a different set of information such as overall ratings, staffing ratings, quality care, health inspection. And I'm not going to do a screen share on this one because it uses the same tools and same strategies that I just showed you with staffing. But with this data set, you can look at every facilities. You can look at a city, at a county, all the nursing homes in the county. You can identify whether they are for-profit or nonprofit or government. You can look at how many residents they have. You can look at their whether they've been fined, how many times they've been fined. You can look at a whole lot of information. And just some summary data on Pennsylvania. And again, the Pennsylvania tab will have this information, and this is the statewide findings. What we see here is there are 688 facilities, 79 of them are 1-star, 20 are special focus facility candidates, and 4 are special focus facilities. Special focus facilities, it should be noted, these are facilities that, again, have a history of problems. If you are running a nursing home, you do not want it to be a candidate or a member of the special focus facilities program. Interestingly, Pennsylvania has more than 50% of its nursing homes are for-profit. 44% are nonprofit, and 4% are government run. And I can't tell you how this, I think this is roughly in line with the national average. I know that nationwide, there seems to be a growing proportion of for-profit nursing homes. And just going off memory here, this seems consistent with national trends. So again, these numbers, many of them will go in one ear, out the other, but I'm hoping what we can get from this is how to find these data, how to access them, and how to learn what's going on in your nursing home, in your city, in your county, and in your state. So the last thing that I'll be talking about is a presentation, a project that our organization with Richard Mollett and our policy attorney, Haley Cronquist, worked on over the past year. And it is about nursing home oversight. We called this report Expectations versus Reality, or we called the project Expectations versus Reality, because on the first part, you'll learn about what we should expect from those responsible for ensuring that nursing home residents are safe and treated with dignity. And in the second part, which is more data focused, we will learn about the extent that the requirements for nursing homes and the agencies responsible for overseeing them are being realized in the lives of nursing home residents. These two reports are available at the link at the bottom of this page. You'll see it on the next slides as well. It's NursingHome411.org/survey-enforcement. So part one, it's really worth digging into. It is about the expectations of nursing homes, and this can be of use to ombudsmen. It can be of use to families. It can be of use to researchers in terms of understanding what the state's role is in nursing home oversight. What's the state's role in certification? How many surveys do they need to conduct? How frequently? Are there rules about how many people they need on the survey teams? What do they do if a nursing home has repeat violations? This guide, which again, it's available on the link below. It covers so many of these important topics, and it does so in a user-friendly way where you can break it down by topic, you can break it down by subtopic to find the different roles of the state in terms of nursing home oversight. Now, what I'm going to spend more time talking about with you is the data component of the report. This is the reality in the expectation versus reality. So this is an assessment of state and federal enforcement agency performance, and it provides the results of an analysis of survey and enforcement data at the state, regional, and federal level. What we did in this report was we evaluated 290,000 surveys. This is over a 3-year period. And this seems like a lot. It is a lot. It crashed my computer several times. But each survey is coded with an F tag. And an F tag is what category of nursing home regulation was cited. Was it resident rights? Was it staffing? Was it infection control? There's a whole list of F tags which assign different types of deficiencies to different F tag numbers. And the second data component here is the severity code. And this is what level of severity A through L did the surveyor determine. So surveyors determine a level of severity with L being the most severe and A, B being not at all severe. And the cutoff on what they consider harm is G through L. And what they consider immediate jeopardy is J through L. So our report evaluates survey data on the following categories. So on antipsychotics, on infection control, pressure ulcers, quality of life, resident rights, and sufficient staffing. The table on the right is just a sneak preview of the 290 row Excel file that we worked on to explore the data. And just to show you, each observation is assigned a deficiency tag number. So this is the F tag, and it's assigned a scope and severity code, A through L. Now, I've talked a lot about data, and I think it's always important to step back and remember that while this is 290,000 rows of code and letters and numbers, each of them have a story attached, and each of them have a resident involved, each of them have a staff involved, each of them are part of a family, part of a community, and these are people that we're talking about. And again, what I'm going to talk about on this slide is one of 290,000 or so examples. And of course, we did not dissect all 290,000, but we have explored these and read our fair share. So in this case, a Michigan nursing home was cited for failing to provide enough nursing staff every day to meet the needs of residents. So a surveyor went in, they learned that from talking to residents, from observations, that there were slow call light responses, there were staffing shortages that were worse at nights and weekends. I know some of you, I can't see your faces because my screens are covered in the PowerPoint, but I suspect this is a very familiar story with a lot of you and your family members, and with the residents that you are advocating for. But one of the residents interviewed by the surveyor said, and this is quoted in the deficiency report, I'll quote, "For the last couple of weeks, there's only been 2 people at night. I've had a medical condition. It can be frightening." So this resident, we don't have the audio, but the text sounds to me or reads to me like a resident that is genuinely fearing for their safety and perhaps their life. And this deficiency was cited as F725, that's sufficient nursing staff, and it was cited as E in severity. Now, again, what the threshold for harm is G. So this, despite of it really looking like a unsafe situation and a frightening situation for the resident, was not cited as harm. There are 290,000 of these in 2018 to 2020. Some may be more alarming than others, but again, they all have people involved. So what we evaluated in this report was annual citation rates. This is how frequently are nursing homes cited in a given state per capita. And then citation severity. This is what proportion of citations were cited as harm. That's G or above. And that citation in the previous slide would not be cited as harm because it was categorized as E. And higher rates will imply more frequent citations, and a higher percentage of G plus harm citations implies greater severity. And in this report, we were looking to determine whether some states were more likely to cite nursing homes overall, or to cite nursing homes in specific categories. As an example, in Pennsylvania, surveyors recorded 0.0 citations per resident per year. This was in the middle of the pack, and actually the exact same number as the national average. So our summary findings I'll give you USA summary findings and then Pennsylvania. So surveyors recorded 1 citation for every 13 residents in the 3-year period from 2018 to 2020. So that means that at a 130 bed facility in a given year, there would be around 10 citations. That will fluctuate by state, by region, by area, but that's what that 1 citation for every 13 residents means. As for severity, of the 290,000 citations, only 5% were categorized as harm, that is G or above, and only 1.8% were categorized as immediate jeopardy, that is J or above. Now in Pennsylvania, that number was even lower. So in Pennsylvania, surveyors identified harm, G or above, at half the rate as the national average. So 2.5% of citations in Pennsylvania were cited as harm. And in immediate jeopardy, only 0.4% of citations were categorized as immediate jeopardy. And that's significantly lower than the national average of 1.8%. Now, some categories were more likely to be cited than others. For example, infection prevention and control accounted for 8% of all deficiencies. I did not look at Pennsylvania's breakdown in this category, but I suspect it was similar. And we should note that many of these citations occurred during 2020 COVID year. So there might be there might have been more attention to infection control. There might have been more deficiencies related to infection control. Now, other categories, antipsychotics, pressure ulcers, resident rights were cited less frequently. Those categories accounted for roughly 2% of all citations. Sufficient staffing accounted for 1% of all citations, which to me is alarming given what we know about the importance of staffing and how it is so important to the care of residents, to protecting the dignity of residents, to ensuring that their rights are protected, to ensuring that they are getting the attention that they are entitled to. Then quality of life accounted for 1 in 1,000 of the citations, 0.1%. So again, some categories accounted for more citations than others. And I added the source here just in case you want to look at the data sets yourself and look at the source material. But I'm going to exit the screen share and I'm going to visit the report just to show you quickly how to navigate it. Share screen. So this is what the report will look like. I lost it on my screen. Okay, this is what the report will look like. And you can see on the left is the expectation. That is the guide that I mentioned, which covers the different responsibilities of the state in assuring quality care. And you can download the full report. It's 90 pages, or you can break it down into individual sections. So you can look at the introduction, and this is just more a summary of what the report is and the responsibilities that it will highlight, or you can dig into specific categories. So I'll open survey process, and here you'll learn about survey team size and composition, how frequently surveyors must go into nursing homes, what are the rules about conflicts of interest for surveyors, what's the complaint process for how state agencies manage complaints, what are the types of surveys and how are they conducted, what are the actions taken when a nursing home is not in compliance. There's so much information in here, and it's organized in a user-friendly way for you to really dig in and say that you heard that surveyors were in your mom's nursing home. You can use this to see, was everything going on as it should have been? Why haven't they been there in 18 months? Is that in violation of some rule? What are the, was it the correct amount of people that were in the nursing home, the correct amount of the surveyors, but you can use this to inform your advocacy and to really have a better understanding of whether the right procedures are being followed. And as for this is part one of the report. The other part is the expectation, the reality, and this is the data component, where again, we've listed it, broken it down into different sections. You can look at citations related to antipsychotics, pressure ulcers, resident rights. Let's take a look at, we'll just take a look at overall citations. And again, this is every citation, so this includes antipsychotics, every FTAG number. And within each section, we have an introduction, we have key findings. Again, this is the 1 in 13 that I mentioned before. It's the national average. It's also coincidentally Pennsylvania's citation rate. And within each category, there are maps that will show you how different states fare, whether they are more likely to find citations or less likely, whether they are more likely to identify harm or less likely to. And you can also access tables that provide that information. And the last thing I'm going to show you before I hand it back over is we have a Tableau page, which can be a little tricky to navigate, but over here you can see it's just a more interactive version of the information that I just showed you in the PDFs, and you can click on Pennsylvania, and you can hover over it to see its data on different categories. You can look at antipsychotics, you can look at different categories and see what's going on. And it's some people will find it just easier to look at the tables and scroll down, but for sometimes a visual can be very powerful in terms of understanding what is going on. So on that note, I'm going to stop sharing, and I just want to reiterate that what I hope we all get from this is not necessarily remembering that it's 1 in 13 citation, one citation for every 13 residents. What I hope that we've learned here is how to find some of this data, how to navigate some of these data sets, which I know can be intimidating. And just as a side note, we're always looking for feedback on how we can make it more user-friendly. But what I hope we can accomplish here is that you are now better equipped to see what's going on at a nursing home of interest, to look up its 5-star ratings, to see whether it's a private or a for-profit or a nonprofit, to see its staffing levels. But thank you for handing me the floor here, and I appreciate the opportunity.
Well, Eric, there are a number of questions in the chat.
Okay.
Whenever you're ready, do you need? Yeah.
So do you want to read them off, or should I read them off?
Yeah, sure. The first question is, what impact have you seen regarding the vaccine mandate on staffing? This is from Jamie Rose, and she says that I have just heard of nursing home staff striking currently. This is very concerning for resident care.
Yeah, that's I don't have a clear answer here. Our latest data is from the second quarter of 2021. From what I understand, there was less staff that quit than was expected because of the mandate. And I want to find articles that have reported on this better than my memory. but there's a lot of various variables at play, such as the pay of nursing home staff, the safety of nursing home staff, and the mandate. There are likely people that feel more safe with the mandate in place. There are also likely people that, and I know this, there are people that quit because of the mandate. I cannot say for certain whether that has what the exact effect that has had. I know that the mandate did significantly raise the vaccination rate of nursing home staff. I was following these vaccination rates in New York State in the days leading up, and it shot up I don't want to give an exact number, but it went from plateauing for a little bit, and then as the date approached, there was significantly higher rates. And the other piece of information I have is that staffing did decline from the second quarter to the first quarter. The staffing ratios declined. This was in part due to a rising resident population. Census had been dropping for several quarters, sadly, because resident fatalities due to the pandemic and for other reasons. But there was I believe it was a 4 to 5% drop in staffing ratio from the second quarter, or from the first quarter to the second quarter. We do not have the third quarter staffing levels yet, but that will, again, add another piece to the puzzle. That's a long way of saying I am not exactly sure what effect, if any, the mandate had on staffing levels.
It'll be interesting to
Okay.
see when you get that next quarter in.
Right. The next question is also about staffing, and they ask how up to date is the data in the report on staffing on the NursingHome411 website. They go on to say that Department of Health documents when they visit on a complaint or survey.
So we and CMS, that's the Center for Medicare and Medicaid Services, provide quarterly payroll-based journal data. So these come out every 3 months. This data that I showed you was from the second quarter of 2021. And so that is April 1st to June 30th, or the last day of June. And it was published by CMS in mid-October. We published it on our website in mid-November. But yeah, that's from the second quarter of 2021. The third quarter data will probably come out in mid-January if it keeps the same, if it's consistent with the delay of previous quarters. And what we publish is the raw staffing data. So it's a giant data set that has staffing hours for every position at every U.S. nursing home in every single day. So if you want to find out what was going on February 3rd, 2021, our data doesn't tell you the specific data by day, but the source material can tell you whether there was higher than normal staffing levels at a nursing home on a given day. Our research and established research shows that staffing levels on weekends and holidays are significantly lower, and that's something we've started to look at. But our data just takes the quarterly averages. And we provide the links to the source data if you want to look at what's going on in a specific day, but we publish the averages by the quarter.
Thank you, Eric. Jen Costello has a question. Do you ever compare federal inspections with the local inspections? She says, I have had the opportunity to attend a federal survey when they were reviewing the local Department of Health surveys. It was very interesting.
Yeah, that's also, do we compare, I can't answer that with any certainty. I'll need to write that down. Yeah, we don't, but yeah, the data we have is from the federal data set.
Right, it's Jen Costello. You know, I just found it very interesting because I think even for people who are on this call, we can find inconsistencies from county to county, depending on who is your licensing, you know, surveyors. We get to know them. And so, you know, it was interesting. And I was happy to hear that the federal government actually will come in and do, you know, an unannounced spot check on after a survey has been completed. They will come in and they will see if they come up with the same findings or, you know, anything additional. So, you know, it's that continuity, I think, you know, looking at, I can speak to it regionally, I can only assume nationally. You know, there may be some variations here and there, like you said, like interpreting the data, you have the raw data, but, you know, when you have one area that's so low on, you know, picking up on a particular deficiency, whereas nationally it doesn't match up. You know, I think it's interesting.
Another question. Why do you think inspectors are not citing the harm categories as actual harm? I'd be curious to see what instances they actually did use the higher tags.
So I don't have a great answer for you here, other than there's a philosophical kind of disagreement of what means harm. I've read, we do this, it's called our Elder Justice No Harm newsletter, where each month we'll publish a few examples, such as the one I described at the Michigan nursing home, where they seem like on its surface they should be cited as harm, and they're not. Now, when we are looking for these examples, we will stumble on some that are cited as harm and immediate jeopardy. These are cases of abuse. These are sometimes falls that are just, it's not, there's no gray area. They were a result of neglect. But a lot of the ones where there's any, and this is just my editorializing, when it seems like there's wiggle room, they end up not being categorized as harm citations. And this has been consistent for, I've been looking at this data for a couple years, but it's my understanding that this is not a new trend. This is something that's been consistent for many years.
I have a question myself, Eric, concerning the monetary penalties. We have a local facility that had been cited a number of times with monetary penalties, and then it's like they all dried up. They just didn't, they just weren't citing them, punishing them, I guess, with the monetary penalties. And I'm curious about that, because the funds are available. I mean, not, I don't believe for a minute that the facilities are guiltless in this, because they are repeatedly recited and recited for the same situations.
When you say dried up, are they not paying, or is it just not changing the behavior?
Even the facilities that are on the list of the poorest facilities, essentially, in the country, are not being assessed monetary penalties. I mean, they're just, why isn't it happening?
Yeah, that's, you're preaching to the choir here.
Right.
Yeah.
I'm not sure if our audience is aware or not, but on November the 23rd, the Long-Term Care CC Community Coalition had a webinar where they reviewed the first part of the guide to nursing home oversight and enforcement. There is a second part coming up, the broken promises part, an assessment of nursing home oversight. That will be on Tuesday, December the 21st from 1 to 2 p.m. Eastern time. I will send that out tomorrow whenever, so that it can go out, Jay, with you all. There it is. Eric
Yep.
has already signed.
If you're
put
not
it up
sick of me
there.
talking about enforcement, you have
No.
another chance.
So I think it's important. I mean, the information that's available in these two publications is incredible as far as I'm concerned. So I will get off my soapbox. And
I appreciate that.
I think we've got all the questions out of the chat. Do we have any hands?
We do not have any hands at the moment.
Okay, Liza.
Thanks so much. I'm just going to give a quick plug to, I'm going to put our email list so people can, we send out an email whenever we have something new and interesting. And if you're interested in these reports, I think you'll like some of our other materials.
I have a really serious question. I see the quilt made out of T-shirts behind you. 2 questions. Did your grandmother make that for you?
She
and the other question.
Yeah.
She had it made for you?
So
and I see
so the quilts,
NCA.
right.
Yes.
So my late grandfather loved basketball. He used to take us to the NCAA championships, Final Fours every April, and he would buy T-shirts every year. And after he passed, there was an entire cabinet full of old T-shirts. Some of them you can tell they're real because they have the mustard stains and they have all the food stains on them. But there was all these T-shirts that my grandmother didn't know what to do with, so she turned them into quilts for her grandchildren.
Did you play for Columbia basketball?
I didn't know. I did not. No, I'm more of a spectator than an athlete.
Eric,
my significant other is 72 years old, and he still plays basketball 4 or 5 times a week. So
wow.
Yeah, you can come to Clearfield anytime, and there's a bunch of old St. Francis ponies that play here.
Wow.
They'd love to have you. Including my cardiologist who's in his late 60s. So, but he played for Georgetown.
Great. And is he a good shooter?
Oh yeah.
Okay.
Even having had, he has a Popeye muscle in his upper arm that has atrophied. So, but he's still a good shooter.
That's great.
Hey, Eric, I have a question. Sorry,
Hi,
I wasn't
Chris.
able to see how to raise my hand here, but I try to filter by county and also by city. And I was looking specifically for Erie County and the city of Erie, neither of which I was able to find.
Huh. Is this in the staffing file or the
Excel spreadsheet that came up as the PA dash. Oh, okay. Maybe it's because it's the 1-star.
Yeah, so it's possible that there were no 1-star.
1-stars.
or-
Okay. Maybe that.
or
Okay.
facilities.
Maybe that was it. Okay.
Yeah.
All right.
It's
Thanks.
it's worth checking the overall provider info data set because again, as I mentioned before, mistakes happen and I wouldn't rule out us having, we check it several times, but it's not impossible that we have an oversight. But yeah, it's worth looking at the
Thank you.
overall
Sure, I made my mistake here.
provider data set.
So to find the report, then I don't go to, do I just download this state's most recent staffing data? Is that?
Yeah, yeah, that
download
should be
the whole
the,
thing?
yep. And then, yes, so that should be the staffing data. And then you can, the nursing home info and ratings will be the most recent. We update that every 6 months. And same with the 1-star and special focus. And those should all be fresh links.
Appreciate your help with the information. Very,
Of course.
very interesting. Thank you. Thanks, everyone.
Yes, fantastic information. Oh, gotta love children. I apologize. So thank you so much. Excellent presentation. And I have a lot of digging to do on your website. There's
All
some
right,
good
good
stuff
luck.
on there.
Yep.
Thank you so much. And then quickly, I'm just going to.
Eric, thank you so much.
Mhm.
Alrighty.
And
And then,
I wish you and all of our members tonight happy Hanukkah.
Thank you.
absolutely. And I just wanted to review our upcoming topics. We only have one more presentation for 2021. So our last meeting will be December 14th. And we're going to check in with several of our peer residents and see what their perspective is. We're going to compare their experience with the holidays from last year to this year, and hopefully there will be some kind of improvement with the visitation policy opening up. But we would like to hear from our residents. So we will be listening to them on December 14th. So we look forward to seeing everybody at our next and final meeting for 2021. And if anyone has any questions, you can always give Jay a call or email him at the Pennsylvania State Office at 717-783-8975 or LTC-ombudsman at pa.gov, or you can hop over to our Facebook page where you could catch this recording, and we'll be sending all the slides and link information to everyone tomorrow in our follow-up email. So have a great evening, everyone, and we'll see you on the 14th.